know that we have the responsibility to see older adults throughout the city of Philadelphia as the area agency on aging. And when they're in their time of crisis, the last thing that they want to do is contact their office, contact their care manager. So utilizing the data from HS, it really gives us that real-time information when somebody's hospitalized, when they may have to be placed in a short-term nursing facility for skilled care. Gives us that almost immediate response to be able to navigate their care plan, put their services on hold, and then if we need to, go out and see them in the facility and then help with the treatment team with navigating services for when they return back into the community. HSX brings tremendous value. Again, there are instances where people would be hospitalized and we weren't sure where they were. There could have been instances where there could have been weeks before we found out that they were hospitalized. It's just more difficult then to really track consumers down when they're in their time of crisis. Their families are not thinking about contacting us. We should be the last thing on their minds when they're in the middle of that emergency. So it's been tremendous value to us because then it helps us work with the treatment team, helps us work with other community-based organizations, think about next steps if we need to make some adjustments to their care plan, and just making sure that we're doing everything we can to support their needs in their time of crisis. We certainly collect a lot of data. And one of the things that we've been eager to do is just analyze that data a little bit better and ask ourselves, are we asking the right questions even? You know, we could put our fingers on output anytime. I could tell you anytime the number of meals that we serve, the number of home care hours that we provide to older adults, things like that. But again, how does that help us analyze and understand how this is mitigating hospital readmissions or making sure we're doing our part to keep people in their homes and community as long as possible. So I think we could do a better job even in the future as an organization with connecting to other community-based organizations and analyzing our and their data together. So that way we could make sure that we're doing an even better job of shaping our programs. So we're constantly looking at our programs. Here in Philadelphia, we're fortunate to provide over 30 programs and support over 140,000 older adults each year. So we're constantly looking at ways that our services touch the social determinants of health. What are the things that we could do to make sure that we're mitigating those risks? We're trying to connect our services to those social determinants of health so that way we could have a positive impact on those social and other factors that are impacting people's quality of life. So again, I think PA Navigate is really the next step because it then helps not only our agency, but it also helps other community-based organizations really do an even better job of connecting to the payer, connecting to the hospitals, and so long-term services and supports is really best served, it best serves older adults when there's a better connection, better warm handoff between the community-based organizations, the hospitals, and the payers. Over the years, we've been concerned and complained about not having the ability to find certain consumers in their time of need. There have been challenges with some older adults and they may not have the appropriate informal supports to really help them navigate a very complex long-term services and support system. So again, with the information at our fingertips, where we could help them navigate a little bit better, we know that we could then help them with connectivity to programs and services, whether it's through our office or other agencies, even faster than we do now. And again, when they're in that place of crisis, potentially hospitalized, that's the opportunity time for us and other community-based organizations to jump in and provide those critical supports before they're even discharged. Before I've worn my hat here at PCA, I was the director of the Bucks County Area Agency on Aging, and I was very interested in the supports and services that HSX provided even then. So having an opportunity to have Philadelphia be my home now, I just see more growth, more partners, greater opportunities to work with other community-based organizations. There's been a lot of interest at the state level as well. So again, I think the state, specifically the Department of Aging, as well as the Department of Human Services, has been very interested in making sure that there's greater connectivity between us as AAAs and HSX and other HIEs across the state. So I see growth.